Since I was a small child, I have had issues eating fatty foods. My mom loves fried chicken and biscuits. I hated these foods. They made me very sick. I would sometimes throw up. My concerns were brushed aside. I was told I was just being a picky eater. In late 2009, I started having stomach pain and nausea when I would eat food. Since I was recently diagnosed with postural orthostatic tachycardia syndrome, abbreviated as POTS, I was assured my stomach issues were just a normal part of having a medical condition which affects the autonomic nervous system. Many people with POTS have slow stomach emptying. As the weeks passed, I could eat less and less. Finally, in February 2010, I went to my primary care physician. I was doubled over in pain. I could only tolerate eating clear liquids. I was sent to the hospital. At the hospital, I informed the physician I thought I was having gallbladder issues. The doctor disagreed. He told me I was too young to have gallbladder problems. I remained in the hospital and could only tolerate eating clear liquids. In a divine miracle, a woman came to the hospital on a Saturday morning. It was determined she needed to have her gallbladder taken out. The surgeon was called in to perform the procedure. The doctor thought since he was called in to do one gallbladder removal, he would also take out another patient's gallbladder and my gallbladder. After surgery, the surgeon came into my room. He seemed sheepish. He told me he had no intention of taking out my gallbladder until Monday, and out of the 3 patients, my case was ranked the lowest. However, when he did the surgery, my gallbladder was inflamed, infected, and about ready to rupture. My gallbladder was 3 times the normal size. If the surgeon would have waited until Monday, my gallbladder most likely would have ruptured, and I most likely would have died. He said out of the 3 patients, I was the one who was truly the medical emergency. After surgery, my pain subsided for 1 day, but then it came back as I tried to eat. I struggled to consume calories due to severe upper GI pain. In the weeks to follow, I did endless research trying to figure out what was causing my pain. I carefully documented what I ate and any associated symptoms. I came to the conclusion I had pancreatitis. When I saw my GI doctor, I told him I was having issues eating fats and proteins. I told him my pancreas was the issue. My doctor did not believe me. On the way home from my appointment, I stopped at the store, bought a small fish. Upon arriving home, I cooked it. 4 hours later, I was in the emergency department with an acute pancreatitis attack. My GI doctor looked at me in disbelief when he saw me back in the hospital. I told him, "See, it is my pancreas making me sick." My doctor asked, "How did you provoke a pancreatitis attack?" I told him, "This is what happens every time I eat fat or protein, except I usually do not come into the emergency department. I stay at home and fight through the pain." The doctor agreed. It probably was my pancreas. He referred me on to a specialist. When I saw the pancreas specialist, he did an upper endoscopy called an endoscopic retrograde cholangiopancreatography, or ERCP for short. An ERCP is a procedure in which a scope is placed down your throat, through your stomach, and into your small intestines. The endoscope then injects contrast into the pancreas and bile ducts. A special attachment on the endoscope can allow the scope to travel up the biliary ducts into the pancreas, gallbladder, and/or liver. Pressures can be measured in the ducts. Tissue samples can be collected, and stones and cysts can be removed. Testing revealed I had high pressure in my bile ducts. My bile ducts were stented open, and my sphincter of Oddi was cut. My diagnosis was sphincter of Oddi dysfunction, type 2. The doctor felt confident he had solved my medical case. I was referred back to my GI doctor. In the years to come, I continued to have severe issues with my pancreas. I was hospitalized for pancreatitis countless times. I had a feeding tube into my intestines, which failed after 3 months. I could not tolerate the feeding tube formula. I then was switched to IV nutrition called TPN. When doctors would see my young age, I was immediately told my pancreatitis was due to alcoholism. I would become very upset. I would tell the doctor, I do not drink. However, it often did not matter what I said. I was told I was lying. I was informed alcohol is the primary cause of pancreatitis. It was alcohol which was causing my continued attacks. Every hospitalization, I had to brace myself for the onslaught of accusations. Eventually, I regained the ability to eat by eating almost no fat and only small quantities of protein. My diet was mostly vegetables and a small amount of fruit. In 2018, I again became extremely sick. I went back to the pancreas specialist. Unfortunately, he no longer would do procedures on people with complicated medical histories. I now had a tracheostomy and a ventilator. He refused to do anything for me. I desperately searched for a new doctor. When I finally found a pancreas specialist, I had lost a lot of weight. The new pancreas doctor did an upper endoscopy, endoscopic ultrasound, and ERCP. It was discovered I had a 1-inch cyst blocking my main pancreatic duct. This meant every time I ate, all my pancreatic enzymes would get trapped in my pancreas. The pancreatic enzymes were digesting my pancreas. This was the reason I could not eat. The cyst was drained. It took about 3 months before I was able to eat again. My doctor ordered a genetic panel which looked at 12 genes known to cause pancreas issues. When my results came back, I had 6 mutations on 5 genes. The doctor told me, well, at least we now know you're not a closet alcoholic. The doctor meant the words to be a joke, but the harsh reality of his words stung. For more than 10 years, I had been accused over and over again of being an alcoholic. I had been told numerous times my poor behavior was causing my pancreas issues. In December 2020, I had a follow-up appointment with my pancreas doctor. I was eating very little. The doctor referred me on to a surgeon to get a feeding tube. In March, the feeding tube was placed. It was a complete disaster. I could not tolerate the feeding tube formula. Infusing the formula at just 10 milliliters per hour caused me to develop pancreatitis. I was sent home despite not being able to eat. A few weeks passed and I was extremely malnourished. I had a follow-up appointment with a colleague of my pancreas doctor. He did not understand the urgency of my nutritional state. At the end of the appointment, he said if I was feeling unwell to come to the emergency department. I waited a few days, but when my heart rate was erratic, I was extremely tired from doing simple things such as sitting up. I had horrible chest pain and felt as though I could not catch my breath. I went to the emergency department. Lab work showed I was very malnourished and my protein levels were extremely low. I was admitted to the hospital and started on IV nutrition called TPN. I was discharged home on TPN and have gained back almost all the weight I lost. I can eat small quantities of food by mouth, as long as it is not fat or protein. Eating just 4 grams of protein makes my pancreas erupt in pain. My pancreas doctor wants to reduce and eventually end my TPN when I see him at my next appointment. He does not feel TPN is a long-term solution and wants me off of it as soon as possible. If I'm forced off the TPN, I will most likely again become very malnourished. Thank you so much for joining me. Please remember to like and subscribe down below. I hope you have a great day and a wonderful week. Bye-bye.